Jones. My name is Shayla and I'm going to be your nursing student. Can you tell me your name and your date of birth? Okay, she does, and it matches her wristband, so I know I have the right patient. So Ms. Jones, today we're going to be inserting an IV into your arm in case you need any medications that require that route. So all it is I use a needle to put in a little cannula into your vein here in your forearm. Then I pull the needle out and just leave the cannula in there with some tape on the outside. Okay? Do you have any allergies that you know of? She said she does not, so that's good. You're good to go. And then assess the arm, and I ask her if she's had any recent surgeries or fistulas, or if she's ever had a mastectomy on that side, preferably the non-dominant arm. And she says she has not, so we're good to go there. And then just want to make sure that in conversing with her, I know that she's able to follow my commands. And I ask her if she can keep her arm out straight, and she says yes, and she's not going to move her arm while I do the insertion. Okay, so the arm looks good. I'm feeling for some good veins. I want to avoid the joints and be as distal to those as possible. I want to find a good and long and straight one. Okay, I feel like I got a good one there. Okay, so she understands. I can gather my supplies. Let me put first, I'm going to put a pad underneath. Protect from any spilling. You raise your arm. Thank you. Okay, perfect. So before I prep this site, I'm just going to grab my supplies, make sure I've got all ready here. Wash my hands since I touched her skin. Got my extension tubing and my saline. She's not allergic and it has not expired. So I'm going to clean this off just to make sure. Make sure there's no air in there. I'm going to prime my line. Taking that cap off. Set that here for when I'm ready. Okay. Now I'm just going to have you raise your arm again. We're going to put that tourniquet underneath so you can find a good vein. Okay. So I'm just going to wash my hands, put on a clean pair of gloves. When I put the tourniquet on, if I still cannot find a good vein, I'm going to take the tourniquet off, have her apply some heat, or I could have her clench her fist in and out to help them pop. Lifespan considerations, if this was somebody elderly or a young child, I would use a different gauge needle or IV cannula, and I would probably have somebody come in with me to help stabilize their arm, help keep them calm. Okay, I'm going to get my piece of tape ready. Here. Got my alcohol and the needle. Okay. Ms. Jones, we're now going to apply the tourniquet so we can find a good vein. I'm going to make sure to go 15 to 20 centimeters above the vein that I want to use. Make sure this is good and tight, but not too tight. I'm going to check the pulses, make sure we got good blood flow, and it's good. So now I'm going to clean the site in a circular motion with an alcohol pad. Okay. Dispose of that. We are all set. Okay, Miss Jones, you're going to feel me pinch. Just going to be inserting your IV now, okay? Try to stay nice and still. Place my hand underneath the vein I'm going for at a 15 to 30 degree angle. Good. I got a flash, remove the tourniquet. You know, lower it down to the level of the skin and advance the cannula.